Welcome back to the SunMed podcast, where we explore the ancient wisdom of Chinese medicine and how it can help you feel better in your everyday life. I'm Angela, and I'm here with Dr. Shane, our head acupuncturist at SunMed in Noosa. And today we're going to be diving into a topic that everyone can't escape, which is digestion. Whether it's bloating after meals, sluggish bowels, constipation, acid reflux, or just heavy, tired feeling after you eat, your gut is central to your health. In Chinese medicine, digestion isn't just about food though. It's about energy, balance, and how your whole body works together. We'll look at how your stomach and spleen play a role in vitality and what common signs of imbalance are and the simple changes that you can make to improve your gut health and overall well-being. Today, leading into this, I just really want to know first, in Chinese medicine, how is digestion viewed differently to Western medicine?
Yeah. So essentially in Eastern medicine, you don't just digest your food, you digest everything. All information, all of the things that we see, hear, read, everything, all information coming through, all of our thoughts, all of our emotions, everything gets digested. So a lot of the time when people come in with digestive issues, it's not just the food's not just the problem. It's how are they digesting emotions? How are they digesting their thoughts? How are they digesting the news bombardment that we get? All of that extra information that's coming in from the outside world. Essentially, anything that's external gets digested.
Okay, so it's actually really quite a complete, complex view on digestion.
Yeah, it's everything.
As opposed to just what's happening in your stomach and your food.
Yeah, you digest your environment, you digest your lifestyle, you digest everything.
And so I've heard you talk a lot about stomach and spleen, and probably people do if they come into some sort of formal contact with Chinese medicine, they'll hear these terms. Spleen and stomach are often deferred to as the centre and the main thing around digestion. So can you explain this a bit more for us normies?
So for the normies out there,
muggies.
So it's all right. So it's jargon.
Yeah,
and people you don't need to understand it. But here's the thing. So it's like all of the organs are based off elements. So in ancient Chinese cosmology, the earth is the center. And so the earth is the central element. Fire's above, water's below, wood and metal are on the left and the right of the earth. So the organs associated with the earth are the spleen and stomach. In the very old textbooks, when they're describing the organs, when they describe the spleen, they talk about like the actual physical spleen. The spleen in Western medicine has nothing to do with digestion. It's got to do with your immune system. And so, but when you actually read the text, they talk about like there's this empty sac that hangs off the spleen when they do an autopsy. What that empty sac is the pancreas. But they didn't, like when they wrote all this stuff, they didn't realize that the pancreas was a thing, because you can't just cut someone open when they're alive. It's kind of frowned upon
generally.
And so what people are like theorize now is that they weren't just talking about the spleen, they're talking about the actual pancreas, which would make more sense because the pancreas is used in digestion and enzymes and all that sort of stuff. But when a person dies, everything that's in the pancreas actually disappears. So the pancreas is an empty sac. So when they talk about the spleen and stomach, they're actually talking about the spleen. They're talking about the pancreas and the stomach, but it's just been left as the spleen, and that's how it is. So it's a bit of jargon, essentially, but they're talking about the pancreas and the stomach, and they're seen as a central pivot in the body with digestion. And so in Chinese medicine, basically, their job is to transform and transport nutrients. So basically, you break down everything that comes in, food-wise or information-wise, and the spleen and the stomach start sorting that out into what's toxic and what's not toxic. And what happens is if it's in good working order, the nutrients get absorbed and the spleen sends all the good stuff up to nourish the heart and the brain or the mind, and it sends all the toxic stuff out through the stomach, through the small intestine, through the large intestine, to be further refined and cleared, and eventually the toxic stuff's supposed to come out. But what happens is, because we're so bombarded with all the stuff that we get and the bad foods and whatnot, they actually flip and we absorb the toxins and we get rid of the nutrients. And so that's what they're talking about when they're talking about like the central pivot of the spleen and stomach.
Very cool. And so I think you touched on it a little bit, but if you could maybe go into more detail. So how does digestion then really affect energy levels and overall vitality?
Yeah, so that's it. So it's like that's that transformation and transportation of like the nutrients into the thing. And so if the good nutrients are going out of the body and the toxicity staying in, you're going to feel lethargic and tired. But if you're absorbing your food when you eat, you should feel energized and built up, and your energy should pick you up. You should feel picked up instead of like, oh, I'm bloated and I'm there. And that's a sign that central pivot's out.
Yeah, and also I just thinking back to what you're saying about like it's how you digest everything. So like news, or like in my case, like I've realized me digesting violent movies is extremely affecting my mental health.
Yeah.
Like actually affects my sleep, and it makes me feel anxious. And so that's one of those cases where it's like everything that you digest is like, I can really clearly see that that's not healthy for me to digest anymore.
Yeah. I'd say that's probably got a bit more to do with your heart than your digestive system, and that it would be affecting your heart more than anything, but it's still that same mechanism. So it's like it goes through the digestive system first, but once it hits your heart, that's when it's like you're really like, whoa. It's a bit more complex than that. But you are correct. But it's like there's also a relationship between the digestive system and the heart. So it's like,
sure. But some of the things that you like actually digest, like food wise, can cause anxiety and things like that as well.
Yeah.
But yeah, we can talk about that in a minute. Like, I guess those are a lot of common things. What are the most common things that you see of digestive problems that you see in clinic? And then how do you approach that with Chinese medicine?
So IBS, constipation, diarrhea, bloating, reflux, parasites.
That's a big one.
That's probably a whole podcast unto itself. Not as common as what you think, people. And it's very serious when it is proper.
Yeah.
What else? Digestion-wise. Oh my gosh. Sluggish digestion. Yeah.
Yep. And so how do you approach these issues? A similar approach, or what do you look at? Like, what do you do to help someone with these symptoms when they come in?
So it's three main things. It's the temperature of the body, the moisture of the body, and the pressure of the body, or the gases. So it's like, is the body hot or cold? Is the digestive system hot or cold? Is the digestive system wet or dry? Or are they full of gas, or they don't have enough gas? So it's like very much like looking at your external environment. So like, for instance, it's a summer in Noosa, it's hot, it's wet, and it's muggy. You can feel the moisture and the pressure in the air. So it's like it changes the pressure. So when you've got more heat, more water, you've got more gas. Yeah. Whereas if you're in the desert, it's dry, it's cold at night, and the air's a bit thinner, I guess you could say. Yeah. And so it's the same in the internal environment. When we start to like assess a person's body, are they too wet, too dry, too hot, too cold, too much gas, not enough gas in their system? And
then you basically, through treatment and herbs, you're looking at
bringing it back into a harmony, basically bringing that pressure up and down in the system.
Very cool. And so one of the big things in Chinese medicine as well is food.
Mm-hmm.
There's warming or cooling properties. Can you explain a bit of that, and also how understanding these could really help affect like your digestion and health mentally and emotionally because of that?
Yeah, so the easiest way to summarize it is like too much hot foods will like give you diarrhea because it loosens everything off.
Do you mean like spicy foods?
Yeah, spicy. Yeah. It could be spicy foods, or like really, really hot foods will just go straight through you. If it's really, really cold things, it can contract the body. So cold contracts. So think about like when you put ice onto skin, it tightens the skin. Everyone's doing like those ice facial plunges at the moment. Not everyone, but
yes, it's
to contract the skin.
Right, is that why people are doing
it? Yeah, so it tightens the skin and the collagen and all that sort of stuff. And so that's what's happening when you eat cold foods. So your digestive system is made of smooth muscle. So we've got two types of muscles, skeletal muscle and smooth muscle. So smooth muscle is what makes up our organs. And so those internal muscles contract every time cold goes in. So if we're eating cold foods, taking cold supplements or cold whatever, herbs, that causes the contraction inside. And so the body can contract too much, or it can expand too much. And then if the herbs are too moisture building, which would be damp foods like, your burgers, fries, all the good stuff, all the yummy stuff, pizza, cheese, all the world's best foods, they build dampness. Yeah. And so the body turns that into mucus or biofilm. and it holds it into the system, and it causes inflammation. So if it gets stuck into the system, it starts to accumulate too much.
And so once you start to learn about, I guess, where your body is, whether it's too damp or too dry, and then you learn about what foods affect that, then you can sort of realize. And I think after a while I started to realize that cold smoothies and eating a tub of vanilla ice cream was not very helping me, and I had a very beautiful fairy tongue there for a period of my life when I was smashing those all the time.
We did.
But yeah, I guess that's how you can start to learn about what's affecting you, and you probably just when you in tune with your body, you can feel it.
And I'm not I'm not like a Gestapo Nazi with it. You still got to enjoy life. So it's like still have the things that you enjoy, but if they are affecting you, or you do have an issue, maybe it is time to sort of
have a break,
back on it for and be honest with yourself. Because a lot of the time, some people come in and they're just they're not even honest with themselves about what they're eating.
Yes.
Or they're very attached to their smoothies or their cold breakfasts, and
cold smoothies. Breakfast is probably one of our biggest pet hates, isn't it?
Or the medical medium.
Beyond diet and food and all the things, what are other habits or routines that can help with the digestive system and the health benefits?
Chew your food. Don't eat too fast. That's probably number one. Don't scroll on your phone. Don't be watching scary movies or violent movies while you're eating.
Or the news.
Or the news.
It's a scary movie.
Yeah. Don't be taking in other information. Celebrate your meals. Just eat, be present with the food. Go for walks after eating is a really good one. Sunlight helps the digestive system a lot.
Just sunlight and nature. Yeah.
Movement after eating is really good to sort of help the body to digest. All that, all the grounding stuff, it's it's anti-inflammatory and all that sort of stuff, but it's not necessary. Yeah, maybe overkill, but whatever you like, really. It's not I'm not one to judge.
If it feels good.
It feels good, do it.
I was just thinking also just quickly about that, if your digestive system isn't working very well but you're taking a lot of supplements, is it kind of
it's a fucking waste of time.
Yeah. It's superfluous because your body's not going to...
No. And I used to be the worst for this. It's you get a list of supplements this long, and I see it on people's forms, and I'm whoa. And sometimes it's just you're not even absorbing them at all. Let alone there's a lot of people that say you shouldn't take supplements because you don't really absorb them anyway. It's not true. You do absorb, and you will take something in, but if your digestive system's not working at all, it's you're going to be absorbing very minimal. You're better off fixing the internal environment first. If you don't fix the environment, it doesn't matter what supplements you take, you're still going to have an issue. And yes, you will feel better taking supplements, but it'll only last for so long. So you're better off fixing the internal environment, fixing what's going on in there, and cleaning it up first, and then getting on the supplements if you still need them.
Yeah, okay. And where would you start to fix the internal environment?
Well, you need to you need a proper diagnostics.
You need to know if you're hot or cold.
Yeah, you got to go through all of that sort of stuff first and make sure that that's correct, and then small wins. So it's regulating bowel movements first. So making sure that people are pooing at least once a day. So many people come in and they don't poo, they poo once in a week. Mind-boggling for me these days. I used to be one of them myself, but it's it's really important that we're having at least one bowel movement.
Technically, we should be pooing a few times a day.
Poo is good.
One to two?
1 to 2 is good. 3 can be an issue. It may not be.
Depending on the type of poo?
Yeah, depending on the type of poo. And so, if we're talking shit, it should be solid, it should be easy to pass, and basically you should have a ghost wipe. So
it should be pretty clean.
Pretty clean.
Well formed,
flushes down easy, it doesn't float. Yeah, so
sticky.
Yeah, and so it's if you're wiping, if you're standing there using 30 pieces of paper to clean yourself up, then there's an issue. If it's struggling to come out, there's an issue. If it's loose, it's coming out loose, there's an issue. If it's sheep pellets, it's an issue. If there's blood or pus, that's definitely an issue. If there's parasites coming out, there's an issue. Ropeworms aren't a thing, they're not real. That's not an issue. But we'll get into that another time.
Yeah.
Yeah.
Yeah. So that's one way you can sort of go, oh, hang on, yeah.
Yeah.
There's something going on.
There's something
here,
going
if
on.
That's not going very well.
Yeah. And then like if you're bloating after you eat, things like that.
And so like a quick win would be like monitoring that, figuring that out. And even before you get a diagnosis, maybe like if you're eating a lot of cold foods or something like that, you could look at...
Oh man, drink warm water.
Water.
The number one thing that anyone can do is drink warm water.
Yep.
Second would be like fresh ginger teas.
What about bone broths?
Bone broths are okay too. Yeah, they're good, especially if you're blood deficient. Your body needs to build the blood up.
Good for mamas.
Yep. Especially new mamas. What else could we do to get quick wins? To regulate the gas, massage your stomach, just like little circles like that on your abdomen to make yourself burp and fart. Okay. That'll help clear out some gas and regulate that way. Yeah.
Obviously, because this is what you do, but how does acupuncture and herbs help with regulating this? Obviously, they do it a lot faster.
So like acupuncture works on regulating that central mechanism. So making sure that the spleen goes up and the stomach goes down. That's the simplest way of explaining that. I'm not going to get into like the nitty gritty of it. Like, there's anti-inflammatories and blah, blah, blah. But it's like, it increases intestinal motility and all sorts of stuff. It's like the easiest way is just like it regulates that central mechanism. So your body absorbs nutrients and your body clears the toxins. That's it. Yeah. From a herbs perspective, it's very similar to the food. So it's like regulating that hot and cold, the wet and dry, the pressure in the gut, clearing up any biofilms that might be in the system, clearing out mucus, killing off parasites, which we call goose syndrome. If they are in there, there's ways of finding them. If it is through the pulse, it is really rare to have proper parasitic infections. This whole thing of it at the moment is crazy. It's just like it's overkill. The
fad of doing parasite cleanses.
It's a fad of a parasite cleanse. Yeah. And like, sure, some people have liver flukes, but the best parasitologists in the world don't even know whether the majority of parasites are good or bad. So they don't actually know their function in the body. So we don't know what we're doing with the parasites yet. So it's not there's not enough research to back whether it's good or bad. Yeah. So it's like just because you feel better for a short period of time doesn't mean you're going to do it. Be doing and like the like taking cloves, black wormwood, and I can't remember the other one off the top of my head. But they can strip the gut lining as well, so they can cause ulcerations, and because they're not balanced herbal formulas. So I have seen people in clinic who have stripped their gut lining from doing parasite cleanses. It's not good. Yeah. And on a completely unmedical related thing that came up reminds me of that episode of Futurama where he gets a parasite and it makes him incredibly smart. But then that chick, she's really into him now because he's incredibly smart. And then he had to save the day. He had to remove the parasite for some reason. I can't remember what, but it just made me think of that. It's like, we live with parasites. Like the reality of it is they'll probably more likely turn us into zombies. What is the benefits of investing in making sure that you have good digestive health now? Like, when would you start seeing the benefits of? I just even think about this. Like you know, obviously we've seen so many people come through your clinic, and like people have come in for one thing, and then like 2 weeks later they're like, I'm shitting again now, and it's like, oh, you weren't shitting. You probably shouldn't tell me that, but. You know, like, it's amazing, like, actually how many people have this and, like, you know, like, the benefits that this has to your whole existence. Yeah. So a lot of people, like, for instance, like, will come in with pain. So they might have shoulder pain. I don't just treat people's shoulders. I always treat the whole body. Yeah. Because it's all connected? It's all connected. Surprise, surprise. But, yeah, it's like I've treated people for back pain and then they've come in and they're like, oh, doing the best poos of my life. And I'm like, oh, you weren't? And they're like, oh, no, I was only going, like, every 2 or 3 days. And I was like, whoa, and so like that can cause back pain within itself because the bowel's right next to the back. Oh. So if there's inflammation in the bowel, it's going to go into the muscles in the back. So it's like there's all that sort of stuff that goes on. But you know, I mean, like it's going to affect your energy, it'll affect your menstrual cycle, it'll affect your moods. You know, the gut-brain axis is really well documented now. Chinese medicine's been talking about that for 2,000 years. It's limitless. It's like because it is the central pivot of the body, and so it affects all parts. Like it'll affect your cardiovascular health. It'll affect your immune system. It'll affect so basically.
Yeah, it affects everything in a positive and negative way, and it's going to give, if you invest in making sure you get that balance right now, you're going to have much more better vitality and longevity, essentially.
Yeah, 100%. And you'll just...
And less pain.
Less pain, you feel better.
Better.
Shit better. It's one of the great pleasures in life.
It is. We always celebrate each other's great poos when they happen. Spend a lot of time talking about our poos. Well, is there anything else that you want to add about digestion?
It is like, it is the central mechanism of the body. It is really important. And so, like, even, like, reflux is something we haven't really talked about much, but if there is a reflux, that's such a sign of everything's moving upwards, and we call it rebellious stomach chi, sort of. And there is an issue, and it can cause, like, they left for a long time or like suppressed with other medications and stuff, it can, the mechanism's still there, so it's like it's still causing problems. So it's like, even if it is medically functional, like, I don't know what word, like, I can't think of the actual term of what I'm if it's medically managed with medication, it's still not working properly, and so it's causing other side effects in the system. So it's like, it's really important to get on top of it
and actually get to the root cause of the problem.
Not even, it's not even a root cause. It's like, I don't see it as I don't believe in a root cause anymore. It's like, everything's a web, and there's a web of dysfunction that we all have, and it creates a pattern, and it might look ugly, but actually, like, when you clean it up, it starts to make a pretty web again. And so it's like, but if we, like, when we look for a root cause and we start treating it, and it's in a web over here, and we fix this bit over here, but there's still a problem over here, and so then this problem might get bigger because we've only addressed the root cause over here. So it's like, you got to treat the whole system, and so it's not just about get there. I don't believe in a root cause anymore. It's definitely not, because the root cause is the same, and for anything, I'm not even going to get into what that is, but yeah, it's a web of dysfunction in the system, and we've got to treat the whole system.
And I think that's, when people come in and see you as well, that's really evident in, you ask a lot of questions that maybe seem unrelated about all sorts of things, and they're like, but I'm just here about my shoulder.
There's a method to my madness.
Because you're seeing the whole picture, so that you can treat the whole pattern. But yeah, well, thank you very much for sharing that today about digestion. It's funny, I've been having this conversation.
Join our school community.
Yes, join our school community.
If you want to learn more about digestion, if you want to learn, like, more health tips from an Eastern medicine perspective, join the school community. It's free at the moment. Maybe in a year or so it might be charged. We don't know yet. We're still trying to figure out how it all looks. But join the school community. You can ask questions in there, put in some, like, different practices and things that people can do at home, more health tips and whatnot. Yeah,
so we've put some practices in about digestion and what you can do, and tips if you're getting any symptoms as well, some things that you can do at home to treat them. And if you have specific topics that you want to know about, you can put them in the school community, and we can do a little podcast about them and put some practices in there for you as well.
The final tip I have for everyone today on digestion is drinking teas. So things like pu'er tea, oolong tea are really good for digestive health as well.
I'm gonna have another cup.
Yep, that's why I saw it over there. So getting some good quality pu'er teas, because they're fermented teas. So anything fermented teas are very, very good for digestive health, and warming. So the body always needs to be a little bit warmer than it is cooler. So it functions better when it's slightly warmer, but not too hot. It's all about balance. Anyway, see you next time. Bye.